that, and also the heads group, that this enabler is there. So please follow that. I think that will really help. Now coming to, I think I'll go to Professor Brajbhushan first, who is looking at his email. He's also Dean of Administration, so he's quite busy. And thank you very much for joining. And he's doing wonderful, I think, job in incubating a company which is Cute Brain. And he's a basically psychology person, and so he can probably that connects his passion to go for this particular area. And it is a very socially very important topic where he's addressing the problem of children who are not really differentially able, but they are very slow learner. Am I right? And with the help of visual aids and the games and jigsaws and puzzles, he's trying to improve their learning capability and bring them at par with the best in the classes. So I think we would like to listen from you what prompted you to go for this product. And if you have faced any problem, or if you have, you see that the policy, of course, you are part of administration, still needs some improvement that you can highlight.
Very good morning to all of you. The work on specific learning disability that Professor Srivastava mentioned, specific learning disability was something that we started a little later. But right since the beginning of my academic career, one primary area that was always attracting my attention was the focus on neurodevelopmental conditions. Children who are not born with the mental hardwire the way rest of the kids are. And these kids would have all kinds of problems. But of course, you cannot focus on all kinds of neurodevelopmental disorders. So our focus was only on two disorders. One was autism spectrum disorder, and the other one was a specific learning disability. The work on autism spectrum disorder started long back. 17 years ago, we started our research, but the work on specific learning disability started much later. Somehow, we could conclude the work and come forward with a solution with respect to a specific learning disability much earlier compared to autism. So, in 2019, we came forward with a solution. But before I go into the details of the solution, just a brief history of how we identified the children who had a specific learning disability. You might have seen between IIT and the end of Kalyanpur B2 Road, at that time we had 11 schools. We approached all of them and we simply asked the teachers of classes 1 to 5, those who were teaching English, Hindi and Maths, to tell us the name of those students who, according to them, are duffers. Just a one-liner. And all subject teachers identified some 5 to 6 children in their classes. And believe me, this exactly matches with the prevalence rate of SLD. The prevalence rate is around 13% in any given classroom. This was exactly what the teachers had identified. When we asked the teachers, the school authorities, the parents, if they were aware of any issue with the child, none of them said yes. And of those 60 kids who were identified in the first go, except one, everybody was screened for a specific learning disability of certain magnitude. And all these parents were professors, civil servants, engineers, doctors, teachers. So all of them were well educated. Despite the fact that the parents' educational background was pretty good, they were in a decent school where high fee was being charged by the school. Neither the parents nor the school was aware that the child has a neurodevelopmental condition. And then we started developing the intervention, which was specifically to cater to early detection of dyslexia and to help minimize the effect of dyslexia and dysgraphia. Dysgraphia is when your handwriting starts becoming extremely awkward. We developed it. Fortunately, we got grant from the government of India, then Ministry of HRD. And within 2 years, we could come forward with a solution. When we went back for validation, we found that this product was yielding a result with 92% or above accuracy level. And we were extremely glad to have this. But I must confess that at that time, my idea was that we will wait for somebody to demand for tech transfer and I'll be happy with that. I never wanted to venture into the area I am right now. And thanks to SIIC, their team came to me first in, I think, 2019 to tell them that you can go ahead with a startup. And I was still reluctant. And then it was 2022, they again met me. In between, COVID was there. And this time, a 5-man delegation from SIIC came. They did not bother me too much, but they left me with a bug. For next 50 days, I was troubled day and night. I was thinking that I had a brilliant idea. I had a validated product, but because somebody is not asking for it and I'm waiting for tech transfer. So is it that, I will be left with a regret at the fag end of my life that I had something that I could have given back to the society and I did not. 15 days later, I just once called my wife and I said that I have this idea. I'm going to pump in some money into it, more time and resource into it. It might succeed, it might not succeed. And without hesitation, she tells me, if you feel that this is doable, go ahead. Next day, I made a call to SIIC office that I'm going to register for this Cute Brains Private Limited. And this is how the story began. With respect to neurodevelopmental condition, especially specific learning disability, because parents will have a feel, बच्चा सीख जाएगा अभी छोटा है, and schools will think this child is useless, he doesn't put effort and therefore cannot learn. And that's the reason high degree of ignorance still exists in the society. Fortunately, we got two kinds of interesting partners. JK Group here in Kanpur, they were very interested to have an agreement with us. And now, along with Quest Academics Private Limited, which is part of the JK Group, we are into sensitization program for parents. The first phase has recently been conducted and we'll go ahead having series of such awareness sessions. So JK Group has been very instrumental into this. Another interesting feature was somehow this name came up before a foundation in Pune. There is a foundation called Anjali Morris Foundation, which works exclusively into the problems of children with a specific learning disability. And Anjali Morris Foundation has along with the Ministry of Education of Sri Lanka, and they are also planning to launch a sensitization program there before they go for early detection and intervention. The last thing, we are very close to a solution that we are again going to offer in terms of early detection of autism spectrum disorder. Again, just click the photograph of a child above the age of 3. We have tested it only above the age of 3. The child walking in any environment, use your mobile phone. Just based on the gait pattern of the child, we will give you a red flag that this child is having autism spectrum disorder. There are subcategories. Again, this is not a clinical diagnosis, but with more than 93% accuracy rate, it can be detected. So these are two solutions that Cute Brains Private Limited is taking to the society.
Thank you, Professor Rajbu sir. Just one question. This early detection instrument or the a lot of computer component. And before coming, I asked him, how did you manage this? He said, I am MTech in computer science, although I'm a chemical BTech and also chemical PhD, but my master's degree in computer science. So I would like you to tell about your journey and how you are managing the multidisciplinary things happening in your company and what are the problems or successes you want to share.
Thank you. Uh, good morning to all of you. I joined this institute as a faculty in 2005. Now being from an area which is absolutely interdisciplinary and where element of computer science, physics, chemical engineering, material science were heavily involved. When I joined here, I was interested to build a supercomputing facility. In 2007, I met the DST secretary and I asked this question, why India doesn't make high scientific software? Okay, and that was a time, India, of course, used to, and still does, used to import a tremendous amount of deep tech softwares to solve variety of different problems. And therefore, my interest was to get into that field. But of course, this, going forward, we got the first facility as an HPC in 2010. So my deep interest was to develop technologies which can accelerate the discovery of molecules, materials, and so forth. So that's my core as a part of it. But then I often take problems which affects me. So the thought of a soil sensor development came in around 2012. Okay, some visit to Bihar where the challenges were, when I actually seen the challenges, I realized that there has to be some technology intervention. So that was a time when I thought about it, we should do something about it. Okay, I met many of the ICR colleagues, and being from ICR, I met my so-called uncles and, so with whom I grew up. And I realized that inherently there are challenges in other disciplines which are often not interface with IITs. So I started talking to them, and I went to the field and I realized that kuch to karna hai. So there must be something, we must do it. Fast forward, I developed many intermediate technologies, but I did realize that also that farmer need a very cheap, I talked about the cost and it was like 200 rupees or something. I wanted to bring it in less, speed up this. Now often the soil, if you keep it for 7 days, you lose all the properties. The challenge is that how do you instant measure the soil property, because your microbes and everything will die in 7 to 10 days. So, we developed a technology which essentially in instant you can capture it. And I'm very glad that Rajat, who's here now, has taken up this technology, which took 7 years, by the way, because multiple different intermediate technology we developed, and we realized that the one which we have transferred to him will work. And I think he has sold significant and got a lot of traction. And this year, I think he is targeting 1,000 devices. But more importantly, what I'm glad is that, what we have thought about as a starting thoughts to help the farmers, we realized. And one of the important things which helped in doing that is our SIAC. Now, Rajat, I don't know Rajat from before. It was only SIAC who thought about that having agriculture as a team, as a company can be incubated in IIT Kanpur. And by virtue of that, I got to get in touch with him. But my group essentially takes such problems. Okay, and around that time in 2000, before the COVID, I got to see a couple of incidents where I saw people having oral cancer detected 3 months, something like 3 months before, and just died within 2 to 3 months. And again, this challenging problem came up that, is this something that we can do something about it? Can we detect, as, Professor Bhushan was mentioning, and these are all people which have worked poor, when you have no access to the facility, it's important that IITs and technology hub must come forward and come with the technology, whether it's a company to create a company, or not, that's a separate matter. It is a matter of intervention and helping the people. So we have been working for last 4 years, bootstrap to start with. A lot of my friends helped. We created a oral detection, early detection kit. And now we are doing clinical trial. We have done more than last 6 months. We've been going all over the places in UP and doing it. We call it a Muh Pariksha. So I'm glad that we are talking to a company who's going to take up. But my core essence in terms of taking the discovery and accelerating it, something which never died. And around 2019, just before COVID, which was somewhere hung in my thoughts that I must do something about it, because if you think about the discovery of, let's say, drug, it takes $1 billion, around 10 years, huge amount of computational, huge amount of resources to get to a point where one drug is discovered. Now, same thing comes with the material design as well, formulation design or cream. So what we have done is in Pre-Science in Silico, which I founded in 2019 with the help of another co-founder who is an NCL scientist, we are developing a platform which we call it a digital R&D platform. It's a SaaS platform which minimizes the time by 5 times. Often in the lab, in the big labs, it will take 5 years. We can do it in 1 year. And we have demonstrated during the COVID time. We discovered a couple of the drugs which can be reused. Now, I'm glad to say that this platform, Prince 3, is there are more than 300 customers now, and in India and abroad as well. We are catering to the MNCs, and we have 18 scientists. Many of them are PhDs from chemistry, computer science, and here in this journey, again, SIC played a critical role because this company is not incubated physically in IIT campus. So the policy allows us to incubate in the place where they are customers. They are the people who can be helped. We can interact daily. So it's incubated in Bangalore. And I think this is something which we, the people who have started earlier can bring as a feedback that what are the things which work very well and what are the things which requires us to add in to accelerate transfer of the lab thoughts to the market through this faculty entrepreneur policy. Thank you.
Thank you very much, Jayant. I think very interesting journey you had. I think I'm getting a lot of warning to close this session from the organizer. But before closing, I think we had very interesting discussion, and all the faculty entrepreneurs have shared their success journey. But maybe one or two of you can just describe or give your message to the faculty members who are aspiring in future to become entrepreneur. Any guidelines or any guidance you want to give, any suggestion you want to give? Maybe I'll ask Deepak first, and because of shortage of time, maybe one or two can share.
Yes. So, first of all, if you, as a faculty member, want to get into entrepreneurship, one part is where students are doing it, you're only giving guidance. I'm not talking about that. I'm talking about where you want to get involved. Then be clear, it'll demand time and it demand attention. Faculty started entrepreneurship done by faculty, companies started by faculty are likely, in my view, to succeed a lot more than those, for example, incubated by students, because students typically are inexperienced and faculty members are also inexperienced as far as entrepreneurship is concerned. But the technology we are all comfortable with. However, entrepreneurship requires more attention to business development and network and that kind of thing. And faculty members of IITs are taken a lot more seriously when you go out. And you're able to open doors. People are willing to talk to you, listen to you. Typically, your friends are in Government of India in secretary position, or somewhere in the companies, they are in CXO positions. So doors open a lot more easily. So I encourage faculty members for that reason to actually take a plunge. Actually take a plunge. And when you take a plunge, then you'll have to really literally take a plunge. In these days, sometimes it happens, I'm just finished my class in quantum mechanics and I'm making a sales pitch an hour later on AVC. So that's what I feel, that you have to then immerse yourself, and chances of success will improve significantly.
Thank you very much. But the last, I think, words from Jayant, I think. So,
Yeah, I think we are extremely good state. You know, many institutes are now doing it. It's across the nation. This kind of policies are inbuilt. Faculties who are absolutely interested. SIC has been critical in bringing this transformation from just the thoughts to companies. My feeling is that workshops more often will help them to cross the barrier, because often there is a barrier in the lab and transferring it to the thoughts of the companies. There are legal issues, there are other things. But this is true that once you cross that barrier, the excitement starts. You know, and I think what we don't see as a faculty is that we have in this, within the small world of our labs, so we work on it. But the real impact is seen when you go outside the lab. And the point is that many of them are very afraid of getting into this, because they think that the time they will spend most of the time in doing that. And that's another thing which we have, that if we can work with the students, promote the students and work with the collaborators, and need not be only faculty, but otherwise, when you meet other people, and you have the ideas which can create market, I think we should not be afraid of doing that. It's time that we should translate our thoughts, which are high impact, and create the companies, So that's my last few points.
oh, thank you very much, Jayant. I think Sanchita is looking at me to close this session. So I think whenever we